Good afternoon, good morning, good evening, and good night. Welcome to the Chicken Box. It is a beautiful day. You woke up. The Lord let you move your limbs around and smile. Hopefully, you get a chance to eat. If not, are we tired of Zooming? Yes. Are we tired of watching streams? I'm sure we are. Are we tired of television? Sometimes. But are we tired of talking about COVID? Absolutely. Today, Black people versus, I know, another thing. I want to get away from it, but you can't. Vaccine mandates, y'all. What is going on? Vaccine mandates. I'm Kevin Impeccable Peck, your host of the Chicken Box, which is powered by the Afro-American newspaper. 129 years of just informing, inspiring, and education, and keeping the Black community in the know as we navigate through and live and strive and hopefully thrive through this pandemic. Good morning, everybody. Good afternoon or good evening. And I represent the Gen X's. Misha Green from DC. How are you?
Misha Green from DC. I love
right. I should say the go-go capital of the world. How are you?
The nation's capital and the go-go capital. I'm doing well. I had to throw on my glasses because I felt so left out. I normally take them off out of vanity, but y'all look so good with y'all glasses, so I put mine on.
I put mine on too. I'm like, I had to join the family, you know.
Exactly. You look distinguished and smart. So for sure, I'm doing well. I'm super excited to talk about this conversation and hear what other people have to say. This is actually a subject I'm not extremely opinionated on, just because I'm a journalist and have to go by the facts. But I'm really excited to hear what everyone else's opinion is on this.
Absolutely. Dr. Draper, our fearless leader of the Afro-American newspaper. Good morning, good afternoon, or good
Hello,
evening.
everybody. As Kevin said, regardless of the time of day, welcome to the Chicken Box. We're glad that you're here. I'm Frances Tony Draper, CEO and publisher of the Afro, and I'm representing, the millennial boomers, and then the boomer boomers too, and then the Gen X boomers, because boomers still probably influence culture a lot, as do other generations. Anyway, I'm glad to be here today to weigh in on this subject of vaccine mandates.
Absolutely, and last but not least, one of our guest hosts and also Afro staff, Janine Chippy Bass. She put that on there because she's chippy. Some people are not chippy. They're like sticks in the mud that you just hate to even be around because they suck all of the energy out the room. But she is very chippy. Welcome back.
Thank you. Thank you for that welcome. Thank you for that intro. Yes, it makes me very chippy.
Black people versus mandates, you guys. Black people versus mandates. Nobody wants to be told that they can do anything. I think the kids don't even want to be told to take out the trash, let alone somebody getting mandated to get a vaccine that they are. Everybody's on the edge about. Not as much as what they eat, but they're on the edge about this vaccine, Misha. We're going to get into it. If you just tuned in, this is the Chicken Box. And if you're from Baltimore, it is 4 wings and fries. If you're and a half and half, and you like salt, pepper, ketchup on it, some people like hot sauce, and it's a greasy, yummy mess. But it's good. So if you've never been to Baltimore, you got to find a Chicken Box. But for here on the Afro, you have to speak your truth. You don't have to, but we'd like you to speak your truth in the chat, as well as if you're here live with us, because your opinion matters. We want to know what you're feeling out there, what you're going through, what you're experiencing, especially as it relates to this mandate. It's this COVID, I'm even tired of saying it, whatever we call it, the 19, man, we've been talking about Black health at the Afro all month, and the whole world is talking about it. It's got federal, it's got local, big business, small business is getting into it. Actually, on September 9th, President Biden announced that the federal COVID mandates and many locals just follow suit. They're getting it passed now. We'll get into the nitty gritty of the mandates in a second, but first we want to, begin to think about how it relates to our public health. What do you guys think about it? I mean, are you with it? How do you feel about it? Dr. Draper, I mean, we're talking mandates. You're our leader here. And you asked Janine to come on. We're hoping to have one of our young, budding stars, Darius, who's at Morgan State University. I think his class might have gone over. He may be joining us later. Just explain why you decided to have them come on today. In this conversation.
Well, the Afro team is a microcosm of the community. So we're not all monolithic. We just all happen to serve, to work at the same organization. And so thought that we would get maybe some perspective, if you will, from a couple of the different Afro staffers who are not in editorial. I mean, we all are in editorial because we always are talking stories and story ideas, and from a couple of generations. So Kevin, as you said, we're hoping that Darius, who is handling our social media, student at Morgan, that he would be able to weigh in. I know he had a class, so he's running between buildings to find a good place that he can weigh in. And so that's why we asked them to come on today. But really, we also want to hear from our viewers. Our viewers fuel the conversation. And so if you're watching, would you share this broadcast? Yes, but would you also weigh in? Let us know. We see a couple of comments there. Thank you. That fuels the conversation, right? And so we see a couple of people coming through with your opinions about the mandates. But whether we like them or don't like them, as if you're a federal employee, it's going to be mandated. And it's mandated in other places as well. So that's why, Kevin, we invited Chippy on today, and we invited Darius on today. So I'm hoping that he will be there soon or be here soon.
Absolutely. If you just tuned in, it's Black people versus the mandate, the vaccine mandate, the talk that's all around. It's 80 million people in the United States who still haven't decided which way they want to go with the vaccine. There are different mutations of this virus. It has different effects, as we've talked about over the years, of people who have come in contact with it, which they're saying that everybody is going to come in contact with it, depending on your health condition, your immune system, and in fact, if you have what the vaccine has given to help you fight it, will be how you prevail or travail or make it through the situation. Some people, they had it, didn't know they had it. Some people had it, they definitely knew they had it. As we talked about, it was a couple who the husband was saying nobody in this house is going to get it. He got it, went into the hospital, got on a ventilator, dealt with all of the unfair treatment that African Americans get treated with, and wondered why his wife didn't get it, but she snuck and got it. So it's a lot going on. And now the government says they're going to put out a mandate. Why don't let's just hop on the box. Let's just get on the box real quick before we get started, and just take 30 seconds and see how you feel about it. Chippy, how do you feel about this mandate?
Well, again, it's an opinion that is my own. I feel like we should look out for each other. Do your research, find out what the vaccination is really about. Stop listening to a lot of people around you, just their voices. You can pay attention to them, of course, yes, because they do add to what you're saying. But for me, the mandates are, as we know, get the vaccination or be fired. I mean, that's a big question. That's the big decision to make, yes. But if you care about life, you'll really do your research, and you'll find out whether you want to make that decision for yourself and not let everybody else influence you.
Absolutely. Welcome, Darius, Morgan State University. We were just talking about you. Said you had to Zoom in from class. How are you this afternoon?
I'm doing well. It's been quite a good morning so far before I go back to my next class.
Hey, well, thank you for popping in. If you want to just give the listeners just 5 seconds, or no, I'm not give you 30 seconds of what you're doing with us at the Afro, and just we're glad to have you. I mean, we like all perspectives. This is a generational company, a generational show, the Chicken BOXX, and just tune in, Darius. We're excited about the future.
All right. So my name is Darius Brockett. I am an internship here at the Afro, working for the social media department. I'll be doing most of the posts on Instagram and Twitter, and probably you'll see some of my posts on Facebook. And about the mask mandate overall, I'm kind of in the middle about it. On one extent, I understand why we should, I mean, not the mask mandate, but the vaccine mandate. I'm kind of in the middle. For one reason, I understand for safety precautions, you want to make sure people are safe and healthy, and also you kind of want to get back to a sense of a old form of normal, if that makes sense, of people who can actually go around without having to wear masks. But on another spectrum of things, the vaccine is still very fresh, and me being a student, we were required here at Morgan State to get vaccinated before we either moved in or before we was to start school. And if you didn't get vaccinated before that, you are forced to wear your mask the entire time. And again, I completely understand for safety. Me personally, my experience, I knew for a fact that I wasn't going to get vaccinated right away, but I knew I was going to get it done. So if it was up to me, if there was no mandate or if school didn't mandate it, I probably would have waited until January of 2022, if anything at the latest, because I knew I was still going to do it. I was never one of those people who was very skeptical, like, oh, we don't know what they're putting in it. I kind of knew once they saw the numbers. I'm more of a numbers guy. So once I saw how it was more of a positive rate for getting vaccinated and the outcome of it, I was like, okay, this is something I should look into. And I knew I was going to do it, A, to take care of the safety around my family, and B, just to take care of myself. So it was just something that I had to come around to. And the mandate just more so made it official for me to say, okay, get it done now so you don't have to worry about it later when people are scrambling to get it, when it's probably going to actually become charged and people are going to start having to pay for the vaccine.
Man, if you just tuned, thank you, Darius, for your perspective. I know I have a college student in Clark, and they were, I guess, quote unquote, mandated the same if they wanted to come to the campus. But I think since then they have gone back to virtual, all virtual for a second, because it is very hard to figure out unless you have daily testing for everybody who has it and who doesn't. I mean, it's ways to figure it out. I went to a football game and they had it on the Clear app, and everybody had their card uploaded to it, and they had a QR code, and they could kind of see, you know what I mean, who had their card based on the Clear, like the Clear in the airport. But I don't know. Everything is moving fast, guys.
So Kevin, are you saying that they mandated a vaccine for the football game? It was a mandate for that stadium?
You had to, I think you had to be vaccinated, or they were giving vaccinations out at the game.
Wow.
Or I think it was a testing thing too. So I mean, big business is beginning to mandate it, and how do you feel about that? But you, Dr. Draper, you want to get on the box?
I'm gonna get on the box
about the mandate.
So sometimes we don't do things unless it's mandated. It doesn't mean that, the word mandate just sounds like it's so restrictive and offensive, right? But for some things, if it's not mandated, then we don't do it. We just won't, because of lots of reasons. Like Darius said, sometimes it's because, like, I know I'm gonna get to it, but just not right now, right? But if you went to, I think that was the Las Vegas stadium. If you wanted to really go to that game and they mandated, you do have a choice. You have a choice, right? You can either follow the mandate and go, or you can say, no way, I'm not going. You have that choice. And so I think that, even in other places, in smaller businesses, people are starting to say, okay, how do I protect the least of these? How do I protect other people? And if you don't want to come into my space, if I have control over that space, then that's okay. That's your choice. But I don't have to go along with your choice, if that's making sense. Now, the federal government mandate, I think there's just so many questions and so many challenges to that. And as it unfolds, that's going to be an issue. And there's also in the nursing profession, there's shortages. So it's a snowball effect. But here's, Darius, I like what you said. You're a numbers person. The fact is 1 in every 500 people in the United States of America has contracted COVID. The numbers are speaking for themselves. People are still dying, thank God, not at the same rate. So how do we turn this thing around with all of these variants? And it appears that if you look at the data, that those states that have higher vaccination rates have lower COVID infections and lower deaths from COVID. So, I mean, that's what the numbers. So I'm off the box.
Hello, everyone again, and welcome, Darius, on the show today. We appreciate you coming on. Yeah, as I said, everybody before, this situation is very difficult for me because I completely understand people's vaccine hesitancy, despite the fact that the reason why I decided and publicly did so on Afro News to get the vaccination was for my own protection. And so, speaking of the word protection, one of our people who are tuning in today asked the question about the change in the CDC definition of vaccination. And that was really important. I'm glad that this viewer noticed it and that people are noticing that, because it really was something that the CDC tried to do on the slide, which was change this definition in order for people to understand that vaccinations are not supposed to be 100% effective from preventing one from getting a disease, but rather it is supposed to protect someone, and it's not 100%. And so really the problem is that we were under the impression for a very long time with the word vaccine is that we would not contract something with having it. And so the CDC really had to step back and say, hey, that's not what we really meant. And they changed it. And I think, in all the research that the CDC was doing and sharing with us, they were very transparent that it was not 100% effective, that it did not mean you would not contract the virus. But that's why you need people like language people, like journalists and really good people looking at your language when you're putting out marketing materials, because for a very long time, the CDC was putting out information that I think contributes, honestly, to vaccine hesitancy. So let me give you how the definition changed real quick. And I know this is more than 30 minutes, but I really want y'all to get into this because it was a good point, but it really wasn't. I want to make it clear that the CDC did not mean that vaccinations were always 100% effective. So before, it said that vaccination was the act of introducing a vaccine into the body to produce immunity to a specific disease. And now the word immunity has been switched to protection. So it would read the act of introducing a vaccine in the body to protect from a specific disease. So that was the big change. The term vaccine itself sort of got a change itself in the CDC. And I believe went from a product that stimulates a person's immune system to produce an immunity to a specific disease. And now it says a preparation that is used to stimulate the body's immune response against diseases. But the thing is, doctors have explained that in a way that has made sense. And again, they did it on the slide, so it's good that people are paying attention. But doctors then had to answer to this. And they said, well, no, we just have learned more about what vaccines are. And that's what science is. I mean, I think that a lot of people forget that science develops as you test and as you learn. And as Darius said, I was like him. I was waiting to see the science of this vaccine. I don't get the flu shot because my body does not react well to it. And so I think in many ways, we have to remember that unfortunately, science is ever, and maybe fortunately, depending on who you're talking to, science is ever changing. And we have to understand that happens. And so for that reason, the definition of vaccine and vaccination changed. It was a slick thing that the CDC did, but not as a means of misinformation or to mislead people. I think it was a move as science helped inform them as well.
Absolutely. If you just tuned in, this is the Chicken Box where you get to speak your truth. And we see a bunch of people trying to speak their truth. And we thank you because everybody has a different decision to make. Everybody has different information. Everybody has a different choice, including the government, including business. Here at the Afro, we are here to inform. If you have never heard of us, we've been around 129 years. We are here to get the conversation started. We are not authorities on the mandate. Neither are we authorities on the vaccine. We're just going by the science. And sometimes you got to go by the science. Sometimes you say you don't have to go by the science. I tell you one thing, if you pour ammonia and bleach in a bucket, the science happens every time. That thing fizzes up. And if you too close, your eyes are going to water. Some things are scientifically proven to be the fact. This is a place that we speak the truth. And I'm going to speak to you, Larry, because you seem to be disrespectful. And so we're going to block you not because of your opinion, but you're going to keep being disrespectful. So we're going to block you because you don't know how to have a conversation and talk to other African Americans. And this is not the place. This is not Gossip. This is not World Star. This is not a place where you want to come and give your opinion. So see you later, bro. Anyway, Tracy, thanks for tuning in. Elevation, we always respect your perspective, and thank you for the information that you share. And everybody else who's tuning in to the Chicken Box on a weekly basis, we appreciate you. Share the information. Just the CDC mention alone of it changing, I don't think a lot of people know about that change, and you bringing it to the light, Elevation, at least will make you look. Guys, stop listening to all of the facts that you hear on the internet and do some looking and fact checking for yourself. You're going to have to make the decision for you. It's the same way if you choose to get up and start your own business, if you choose to start a career, if you choose to get married, if you choose to move to another state, whatever you choose to do, it is your choice. And the road you choose, sometimes is God's way, and sometimes it's your way. And you'll find out along the road if that was the right road. And the good thing about life, if you wake up every day, you can change it and go in a different direction. This is Black people versus the mandate. Have you heard of everything that's going on? We want you just to be aware and to wake up and not just see the headlines and begin to do some deep diving into what's going on and to pay attention, because the white press is not going to give our community what it needs. Misha, if you tuned in last week, her mother has had to deal with this healthcare, and she got a chance to really see firsthand of what's going on in these hospitals. It's listen, regardless what you want to, science is, if you go spend a day, which you probably couldn't because of everything going on in the hospital, and you will see how immune a lot of our healthcare workers have become to this every day, and how the lack of care for our community is being handled. It's a lot of stereotypes going on out there. Tracy, Diane, thank you for tuning in. Everybody share this information because it's going to help somebody.
So Kevin, let me jump in.
Everybody,
jump in for a minute. I also want to give kudos though to those who are sensitive to everybody in the hospital. There are, having worked in a hospital as a chaplain, I just want to put a plug in. There are nurses and doctors and paraprofessionals, other people who work in the hospital who are very, very, very caring and very sensitive and work hard, especially during this whole COVID crisis. Yes, there's the ones that stick out, are the ones that are disrespectful and seem to not care, or who are burned out. But I know too many that are doing just the opposite. So I know you were getting ready to go someplace else because we want to talk about the mandates. You were talking about getting the right information. I'd be interested in finding out from Darius and Jernine, haven't heard their voices in a couple of minutes, and then Misha's going to set her straight. What have you heard about the mandate? What's the mandate say? Janine, Darius, what do you think? What's the, without looking it up right, what's your understanding of the mandate?
I've heard the mandate that's coming down from the Biden administration or Biden himself, President Biden, in reference to getting the vaccination or being fired. And then there's like the school system, you get the vaccination or get tested weekly. So the options are there. I think it's drastic to say get fired, but if it will help with doing the vaccination, with doing the testing, that would help and give people more time to determine, search, and find out whether they really want this vaccination. And people are seeing like what's in the vaccination and all that. I didn't know what was in the measles, and I'm sure my parents didn't know.
You heard all this though in the mandate?
I'm sorry. Yeah, I switched over. But in some of the conversations, yes, that does come up. It does come up when you talk about the mandate that you have to get it. But then people are saying, if I have to get it, I want to know what it's more about. So that's where I was going with that part. But some of the things that I heard was in the school system, like I stated, and also with, was it OSHA? I had heard about in OSHA that they want to make the mandate or get fined, so those are some of the things that I heard.
Okay. Darius, what have you heard about the mandate in terms of
I've heard pretty much the same thing about it. The fact that it's being mandated through almost a sense of fear, that's how I look at it. That's what makes me just a little bit hesitant, but it also makes me understand people's perspectives, because through the mandate of Biden saying that you get mandated or you can lose your position of employment, school-wise, you get mandated or you follow the mandate, or you either have to get tested weekly or you may not be able to go to that institution. It has the variety of extremes kind of make me question just a little bit of where he really lied, or where the policy lies with the idea of getting fully vaccinated. Because also through the mandate of getting the vaccine, there's also states who are also trying to fight backlash between it as well. So it's always a lot of toss up in between. I know at one point Nebraska was fighting for not trying to force it. Texas at one point were not trying to fight and force it. So it's just things of that nature where it's like, although it's nationally mandated, the state level themselves are still trying to argue it down to find like a perfect medium, I guess, that suits them all.
Misha Green, what are the facts? What did the mandate say? Thank you all. I heard some of those same things.
Thank you. Yes. Thank you all for sharing your opinions. And I really appreciate all those in the comments who are sharing how they feel. This is such a topic that so many people are passionate about. I've talked to some people who have said they're considering leaving their jobs because they do not want to get the vaccine. I've talked to other people who are saying, thank goodness they got the vaccine when they did so that they can remain employed. So this is causing a lot of division, sometimes even in households. And so I really appreciate everyone's civil conversation as we sort of get into what we last year would have been considered uncharted territories. And so again, on September 9th, President Biden announced these federal mandates. And so I just want to talk about the mandates itself, and hopefully a little later we can talk about some of the exemptions and exactly what that means if we get an opportunity. And so employers with 100 or more employees will be required to have their employees either be fully vaccinated or get tested weekly in order to come to work. And Biden said that the Department of Labor's Occupational Safe and Health Administration, or OSHA, as Ms. Janine talked about earlier, would implement the requirements that would affect more than 80 million workers out there. So a lot of people are affected by this. And businesses are waiting more details just to figure out what sort of the formal ruling is in terms of how they will implement these vaccine mandates. Federal workers are and employees of contractors that do business with federal governments must be vaccinated. The Department of Health and Human Services will require vaccinations in Head Start programs, as well as schools run by the Department of Defense and the Bureau of Indian Education. Workers in healthcare facilities that receive Medicare and Medicaid reimbursements, including hospitals and home health agencies, will also have to be fully vaccinated. And individuals applying to become lawful permanent U.S. residents must be fully vaccinated effective October 1st. And that includes those who are interested in immigration here as well, citizenship, as well. And the president encouraged entertainment venues also to require proof of vaccination for entrance, and that's already happening. We had one of our Afro writers attend a show the other day, and they had to be vaccinated. I attended the Restaurant Association of Metropolitan Washington's award ceremony on Saturday. I had to be vaccinated in order to cover that event. So that's already happening at entertainment venues as well. So those are the specifics of the federal mandate. And we, as many people, locales, small businesses, and the like are waiting for further rulings as to what exactly that means. And most of that will have to take place at their places of business no later than October 1st.
Absolutely. This is the Chicken Box. If you just tuned in, broadcast on the Afro-American newspaper, 129 years of inspiring, informing, and educating. And it is a real healthy conversation going on, not only today, but all over the country about the mandate. I'm glad you guys are putting in the chat how you feel about it, because it's different opinions out there. And a lot of times we get mad at people who don't have the same opinion as us. And then we begin to, as my young people call, shame different people because they don't have different opinions of you. You get upset with your brother and sister because they, you thought everybody should wear blue today, but they decided to wear black. I'm just giving you a lighthearted example. It's people in your family and friends who are vaccinated, and people who are not and who are never going to get it, and people who want to get it. So what you do with the information that's out there is going to be up to you. We are telling you that the mandates in big business, they seem to be happening already. They seem to be coming down the pipe, and you're going to have to make a choice of where you work. You're going to have to make a choice of how you attend certain events, if you want to attend certain events. And we don't have all the solutions because we're all going through it at the same time. As a child, I know I had to have my shots before I went to school. That's all I knew. Like, if you went to a new school, in order to start that school, you had to have something called shot records. I didn't know what it was as a child. All I knew is when they said you turn this age, you getting this shot. And that was that. And I guess living through it is a different situation for all of us, because we now get to think about it. You know what I mean? Opposed to just go with what's happening. And so let's speak about it. Everybody got shots who are over 40 as a child, whether it was chicken pox or mum or measles. I don't know all the shots you had to have to go to school. But it's different.
Yeah, before we get on that box about those over 40, we got one under 40 that's getting ready to jump off to go to class. So wonder whether we want to give him a few seconds on the box before he has to leave to go to his next class.
Darius,
so
your final words. Thank you for tuning in, and for everybody. I forgot what kind of fellow you are.
He's a Featherstone. He's a Featherstone fellow.
A Featherstone fellow, yes. and we're glad to have you at the Afro, and everything that you bring, and the energy you bring to keeping us just alive and vibrant for another 129 years.
Yeah. So first, I do want to say thank you for having me on today. This was very much needed for me. I got to learn a lot while being here. Secondly, for people who are against the mandate or even people who are for, just keep doing research, keep looking for more information, because the more you have information for yourself instead of just hearing things out, it'll help smooth your decision whether to get the vaccine or not. As for me, when I got it, I know my immune system is really strong. So even when I did get the shot, there wasn't, for me personally, there was no side effects. But I do know it does come with side effects. So just do your research, take the time to look through it, and it'll make everything easier for you and for the people who you want to protect as well. So again, just thank you for having me on, and I will see everybody later.
Absolutely. Talk to you later, Darius.
Thanks, Darius.
We're continuing the conversation, Black people versus the mandate. We're here to spark your mind to begin to dig and to find out the answers that's going to work best for you and your family. Elevation has put a website for those who can opt out, to give you more information. And there's plenty of information out there if you just take the time to look. This is where you get to speak your truth. That doesn't mean it's the truth, but it's the truth that you believe to be true. And that's what having a forum like this is all about, for us to share, because somebody's going to say something that helps somebody else out. It's a lot of stereotypes also out there on these digital streets, Misha. What are you hearing out there? What kind of stereotypes, or are they stereotypes? Let's hear your list.
Oh, well, there's so many stereotypes. And, I think even just reading, and not just stereotypes, but opinions and thoughts that you can even see in our chat and comments today. And so, again, I appreciate you all for tuning in, because we want to have these conversations. We want to make sure that we are having a good dialogue. So, thank you all again so much for weighing in and sharing your opinions and thoughts on the matter, and throw the stereotypes in the comments and help us out as we continue. Again, I have to emphasize, these are general stereotypes I've seen online. These are not opinions of the Afro-American newspapers. These are definitely not facts that we are providing from the Afro-American newspapers. So the mandates are only to protect people and keep them healthy and safe. That's one stereotype. The mandates are a violation of people's freedoms and rights. The mandates are a complete violation of privacy. The mandates will cause further division in this country. The mandates will mean a lot of people will lose their jobs. Black people are targeted in these mandates. Schools and universities requiring vaccinations are solely doing it to continue getting funding. So that's some of the info that I've seen on these digital streets. So what's going on? What do you guys have to say in the chat? Have you guys heard anything like what I'm saying? Throw it on in the comments.
Is it Charlie Puffy or Miss Brown says, do your research on the nanotechnology, guys? I think what the fact is, and what people are putting in the chat, is that you have to do some type of research. Something. You have to, even when you're going to get your driver's license, you got to do some type of research to find out how to get to that point. You know what I mean? Whatever your decision point is. I'm not here to tell you what your decision point is, or here to bash you or what it is. We're just living in it, and we live under a government. You know what I mean? And if we don't like it, I guess we can move to another country where the government, it fits more of a lifestyle that you want to live. But as we live here, and as these mandates come down the line, we got to figure out how to navigate through. Are you going to start your own business, and then you can mandate your business the way you want to mandate it? But it's this invisible disease. They say masks help, and then they say masks don't help. They say the particles are so small that they can get through the mask. It's people who stayed in their house the whole pandemic and are getting cold. It's invisible, guys. But what is visible is these funerals. What's visible are the people that are dying, right? And we got to take care of ourselves as Black people. We are probably I would hate to say it, but maybe the least health conscious, especially in the South, with heart disease and with high blood pressure and all of the diseases that affect our communities. We have to get our immune systems on track. Just period. That's just a fact. We need to go for a walk every now and then. If you're working from home, you need to get outside. You need to do some kind of circulation, get your heart pumping. Think about eating better. Think about building your immune system up, because all of that is going to help. Not only with COVID, people sneeze now and they think they have COVID. You know what I mean? They the same thing that they're allergic to something in their pillow, and so everything has become, I don't know, I don't want to say brainwashed, but it's like out there so hard that it seems like you can't think about anything else.
It's almost like a fear that's growing up. It's like the mandate is negative, it's harsh, it's telling you, you have to do this. Well, really, you don't have to do that. You have to do your research, find out the facts, know yourself, know your body. Yes, Kevin, it is very important to be out there, to exercise, to walk, to eat the right things, to keep yourself moving, because COVID kept us in the house, kept us still, but it didn't say sit on the sofa and stay there 24 hours or 12 hours and then sleep for the other 12 hours. You still have to take care of yourself. And if you don't want to get the vaccination because the mandate says you have to do this to keep your job, what else can you do? Hey, you want to start your own business? Yes, like Kevin just stated, what is going to be your mandate in your business? Is it just going to be you, or are you going to have employees? We want to keep everybody alive and well. And if it means to keep your mask on around people, get tested weekly, but know your facts. Go find them for yourself and make your decision for yourself and for others.
Absolutely, guys. If you just tuned in, we're just putting it out there. We could talk about this till whenever the pandemic is over, and that's if that happens in our lifetime. We do know that everybody has a time that they're going to be born and that they're going to die. You could be so worried about COVID and not look left. Absolutely. You don't know what's going to happen in the future, but we're dealing with now, and with our mindset and with our education and with our people. When nobody else is thinking about us, we have to think about us. And all of us have a person. I don't care what you tell that person. And you could know that this is the best thing. If you just do this with your immune system every day, you're going to feel better. They're not going to do it. And this is your brother, your sister, your cousin. This is somebody. This is your family. You know what I mean? And they're not listening because they choose not to listen. Not because you're not saying it, but when the information gets out there, my mother used to say, when you know better, you do better. But that doesn't always work. Sometimes you know better and don't do better.
Right.
When you continue to experience the results of that not doing better, even though you know it. And so that then gets into the definition of insanity. Because you do the same thing over and over again, expecting a different result. But I'm getting off the box. Dr. Draper.
Yes.
Listen,
That was good.
I'm getting off the box. I'm just saying, listen, we're just having this conversation. We're talking. We're getting a chance to talk. We're hearing, thanks, Cal, Chris, Miss Brown, DG Gray, everybody who's commenting, mask mandates are laughable if your eyeballs are exposed. That's true, Chris. It's like, what's the real deal? You know what I mean? And then, are you going to live your life all of a sudden? Or are you going to stop living your life because you know, you probably have, depending on how old you are, less time ahead than you do behind. You know what I mean? So you got to move forward. You got to love people, or you should love people. And at the Afro, we love African American. We love all Black people. We love everybody. But I'm just saying. But we spay, it's extra care when it comes to African Americans at the Afro, because if we don't care about it, who is? So,
and we have to tell our own facts. We have to tell our truth because we are the ones that know it. And
that's our truth, and then that's your truth, and then it's the truth.
Yes.
Okay, whatever that is. Dr. Draper.
Okay, I don't know where we're going with this, but next month, I'll give this plug for next month. The entire month we're going to be talking about our health, not just our physical health and not just vaccines, but our mental health, our spiritual health, our emotional health, all those things that we can do, right? That are right there, which may or may not prevent COVID, but it certainly builds up your immune system rather, and the ability to fight off whatever the disease is that comes. You know, people say this vaccine was developed too quickly. Well, researching that, the facts say it's been developed, vaccines have been developed over time for the SARS infection, which includes COVID. So this particular COVID strain. And so things have been going on, but just do your research, corroborate the research, and let's see. Yep. And then as Chris just said, there are children who are, you got all these super spreader events. You have schools that are closing down. You have teachers who are mandated to be vaccinated, but maybe somebody in their house is not vaccinated. So you're still just recycling the virus that way. So there are a lot of things there. In terms of the mandate, like as I said at the beginning, some people need a mandate to do certain things. Others of us, you're going to do it without being mandated, right? Some people, if you didn't have a red light, they never stop at the intersection.
That's right.
They don't stop with the red light.
That's right. That's right.
Right, really. If you didn't have that red light, they wouldn't stop. They would just keep on going and take their chances that they would not be the ones involved in the accident. So I went to Egypt. They didn't have red lights. They didn't have emissions control. They didn't have a whole lot of things. If you had an accident on their through highway, here's the way they settled it, because they didn't have mandatory insurance either. You got out your car. They got out their car. They said, okay, I hit your car. My brother was going to fix it on Saturday. Bring it at noon. That was it. If they didn't have a brother, you know what? Or if you were a visitor like I was, well, just too bad, because insurance. So some of us wouldn't have insurance, car insurance, if it wasn't mandated. We wouldn't do a whole lot of things. Others of us, we don't need that. We're going to do that. And so, where do you find that middle ground? Are you the person that needs the red light to stop at the intersection, or would you stop anyway?
Boom. I don't know. I think the stop sign is cool, but the red light, the red light works as well.
We drift through the stop sign, right?
I mean, unless I own a body shop. Hello, somebody. You know what I mean? Unless I own a vaccine shop. Anyway, that's a whole nother topic. The mandates are circulating. There are companies making corporate decisions based on what their board wants to do. It's like the guy who has the ball, it's his ball, and when the game's over, or when he wants to take his ball, he takes it home. And no, it's not fair to everybody, but neither is sending the kids back to school. I think people got so, and I'm going to go off here because the 5 to 11 vaccine just came out, but they got so tired of trying to be a teacher and trying to get into this new norm that they said they're going to just send everybody back to school, which, as you just mentioned about the teacher, that affected everybody because you don't know who has it. It's invisible. I wish you would turn a color or something so you could see it coming or some kind of way, but you can't.
Or we can do like biblical times, right? And just say unclean, unclean. No, I'm just kidding. But go ahead.
Okay. Don't bring the biblical times into it, but I'm just saying we're so in a hurry to get to a place that we were used to, but who do you sacrifice on that? You know what I mean? Like a lot of us who have gotten the vaccine, and I'm one, I got it because I didn't want to be that guy. I already felt that I don't go to the doctor. I don't get sick. And that's my story. I'm sticking with it. And that's worked for me for years. But I didn't want to be the guy to bring this invisible disease to a 94-year-old in my house. That's why I got it.
And I was the same way. Yes.
It wasn't really for myself. It was for somebody else. It was for my kids who can't get vaccinated because I didn't want to be the guy. So that was my reason. Everybody has their different reason. I know a person who was like, this is a joke and brought it back and both of their parents passed away. And they have to live with that. This is real talk. This isn't just something that I'm imagining. This is a real person that I know who was just out there in Atlanta living whatever, however, thinking it's not real, and then and now it's real. And most people who finally find out it's real is after a tragedy. I didn't want to be that guy. So thank you everybody for tuning in. This has been a spirited conversation. I'm gonna give y'all final 30 seconds on the box. Look up the mandate, see how it affects you. Look up the vax. If the vax makes sense for somebody else, then get it for somebody else. If it makes sense for you, then if it doesn't make sense and you'd rather be tested and you can and it'll work for you, then don't. You know what I mean? This is just information that you have to add to all the other information that's running. But believe me, people are really dying and people are really suffering. And until you experience that or know somebody who has experienced that, then it will become real for you. But God is still who he is. Thank you, whoever is putting that in, and he can protect you and he will protect you. And
Absolutely.
That's what I believe. Before we get to it, COVID ain't bigger than God in my eyes. So I'm going with that. And that's how I'm leaving. That's how I'm leaving the box. Misha.
But you know what, Kevin, I was wondering, before we do our final thoughts, Misha usually does an Afro fact, and I find them so fascinating. Is there an Afro fact for this week, Misha? I know it's not about vaccine mandates, but I know you usually research one.
I do have one this week, and it's a pretty fun one. I was inspired by it. I wish we could show the graphic for it, but maybe I'll screenshot it and just put it in the comments afterwards. But because the photo that week was so inspiring, and I'll tell you about who the three women were in the photo in a second. But this week's Afro Fact is inspired by the September 25th, 1965 edition. And the headline read, "We're coming back," with a photo of activists Fannie Lou Hamer, Victoria Gray, and Annie Devise. And Hamer had stood on Capitol Hill that day and said, "If they don't kill me when the next election comes up, I'll be willing to run again. You're going to see us in Washington and you're going to see us in Mississippi. Brother, we are on our way. Regardless of what you say, we're coming back." And she was talking about the Mississippi Freedom Party, and she was vowing to not let the defeat dim her crusade and the party's crusade in general to unseat 5 congressmen in Mississippi. And so that's this week's Afro Fact.
Okay, form your own freedom party.
Yeah.
I like what Dorothy says. If you don't get the shot, stay on your own island. and that's being not selfish, right, Dorothy? I mean, like, if you say I'm not with it, don't go around people. And you know what I mean? It's just like
I think defensive about it. Just, stay away, or you have your rights. We have my rights when people start talking about that. But, basically, if someone made a statement and they said, stay away from your family, stay away from those you think you might say, yeah, you can do that. But again, that's your decision to do so. But a lot of people want to be around their family, so they're looking to find out how they can do so.
And my thing is, vaxxed or not, I think we should all still be social distancing. I think we should all be really working to stay safe. I saw someone mention the comment about you know, masks not necessarily protecting us, but it's doing something, we know, right? I mean, I have that same feeling. I always wear glasses when I go to the store because I'm afraid of it getting into my eyes. But if everyone's wearing a mask, then the particles that we're breathing aren't getting in our eyes because the mask is covering it. So I think we should still be doing these things to protect us, vax or not, because this separation, as Sherelle just mentioned, you know, it is really dividing us. And I think that's, you know, really very difficult for us in this time of major division that we already have had in the United States. And so we just are all trying to work to stay safe, whether you want to get the vaccine or not, whether you have religious or medical exemptions that prevent you from getting the vaccine. I think we should all be working to stay safe with with this pandemic still very, very much in effect.
Absolutely. And that's coming from a seasoned germaphobe before the pandemic.
Way before the pandemic.
Dr. Draper, final words.
Final words. And we started off, and we've been talking about these mandates, these vaccine mandates. They're here. They're going to be here to stay, right? And so your choice, my choice is, am I going to follow the mandate? And if I choose to not follow the mandate, am I prepared for whatever the consequences may be from not doing that? And as Kevin said, you know, we live under certain governmental rubrics. If we don't like it, then change the laws. Do what we need to do to change the laws. There are processes for that as well. But big companies like Amtrak, Google, Lyft, McDonald's, Microsoft, Netflix, Twitter, Tyson Foods, United Airlines, Walgreens, Walmart, they will all have vaccine mandates. And small companies like the Afro-American newspaper, we will have a vaccine mandate, and people will have to make a choice. Now, on these larger companies, Misha, I don't know if you said this in your facts, you know, the whole thing about the religious, and you did just mention it, and the health exemptions, each company will have to set up how they're going to handle those. And so what's frustrating about the mandates right now, we've never been this way before, so the regulations aren't as clear. And that's what's frustrating some people and some companies, you know, what is acceptable here, what's not acceptable there. So I'm sure there's going to be some confusion about that. But where there's no confusion, is what Kevin said earlier, there's no confusion that people are still getting sick. There's no confusion that people are still dying. There's no confusion that little kids under 5 can be impacted and infected. And I'm going to share this true story because I wrote about it in last week's Afro, of a family, neither mom nor dad believed even in vaccinations. I mean, you can't mandate it in a family, but they don't even believe in vaccinations. And so they didn't do it. They had 4 children, have 4 children. I don't want to intimate that something happened 7 years, I think. I forgot the ages, but all the way down to someone who's like 6 months old. They all got COVID. All right. So mom and dad are faring a little bit better than the 6-month-old who does not have enough to really fight this virus. So it's real, mandated or not. And so we've been talking about it a lot on the Chicken Box because it's so important, and it still impacts African Americans disproportionately. I am off the box.
Thank you for tuning in. Go to afro.com. We have a legacy edition where you can get a newspaper if you'd like to. You can frame some of these great front pages, but we also are on the cutting edge of technology with news every day, every time it happens throughout the day, afro.com. And we're not mandated by another news organization who tells us what to say or what not to say. So the only way that we have existed for 129 years is through your support. So if you go to afro.com and you would consider, for less than 2 Uber Eats, getting a digital subscription, or both a digital and a physical subscription, it would allow us to have these conversations, because somebody is going to find out that Miss Brown has some things that can help you, some herbal things that can help you fight. Somebody's going to find out that Elevation gave you the CDC changes. Somebody's going to find out that Chris said the saints endure and preserve. They just needed to hear that today. Somebody is going to find out something just because we all came together and shared our ideals. Not to be mean spirited if somebody doesn't agree with you, but just to listen. The thing about us sometimes is people, we don't ever listen. We're so quick to give an antidote about something, but we don't listen to each other and really get an understanding of what our brother and sister is going through. So hopefully you can get an understanding about your brother and sister. And on the box, real life story. In my other life, I'm in the music business. I know a music engineer that just had a baby, and he decided that he didn't want to get the vaccine. And he kept going to the studio, not knowing what. And so now his baby has COVID. So keep him in prayer. Keep his baby in prayer that they make it through. And now that his baby has COVID, the caregivers don't want to come and watch the baby. So that has now killed his whole income because now he has to be home because nobody. So it's just things like that. And that if he could go back, he would definitely, when I talked to him, he said he was thinking about it. But if you got a young person, it was somebody who can't fend for themselves, immune-wise in your house, come on, y'all, please do something. I don't know what to tell you, what to do, but do something. And so I'm off the box. Thank you, everybody, for your comments and for continuing and for your opinions and for just hanging out with the Afro and the Chicken Box. Until next week, we'll be here at noon, midnight, or morning, depending on what type of the world, part of the world you live in, just for the conversations. So get the facts. Stop listening to your friends and to the internet and do a little bit of research. Take some time off your favorite binge watching and do some research that makes sense. Have a great day, everybody. Until next week.